Good evening, everyone. Treasure Troller here from the militant state of Michigan. I want to talk about this subject. I've indirectly talked about it. I don't know how direct I still want to be with this because I don't want to have any issues. But it's something that concerns me, and I think it is going to be a reality. And so this was on the internet today, where this doctor was killed by a patient. And it appears he was an orthopedic surgeon. Looks like he may have specialized in hands, wrists, end of arm surgeries. I'm not sure, but more likely than not, he was an orthopedic surgeon. And they hadn't really gone into any of the specifics other than the suspect was caught within about 5 minutes. No one else was hurt. But then there was this article. There was part of the article. Here's a little clip where healthcare workers are becoming concerned about this. There's like a 23% of these kind of fatal or non-fatal shootings, and that it's sort of the violence against healthcare workers is on the rise. And then further down in the article, they put this in where there was another shooting where an individual went in and killed the doctor because they were not able to resolve their back pain. So here's the thing here's my sum of all fears, what I believe is the clear and present danger. I really believe that with all of this reassignment surgery, this trying to keep parents out of the loop, encouraging kids to transgender and whatnot, I believe that some of them down the road, after they've been convinced that they're really not a boy, they're a girl, or they're really not a girl, they're a boy, and have some reassignment surgery completed, that sometime down the road, some of them are gonna go, wait a minute, you know something? I was 10 years old when I said that, and a group of adults convinced me that I was something that I wasn't. And then we're going to read articles online, or we're going to see news articles or on TV of shootings that took place at medical offices, at social service offices, and it's going to possibly involve some of these individuals. So I think it's a concern that many healthcare workers should be, especially ones that are advocating for these reassignment surgeries and whatnot, they really need to think about what they're doing here, because I just kind of think that if you can't resolve someone's back pain, if you it is enough for some people to say I've had it and someone needs to pay for this, if you disassociate them with some of their body parts, and then they reconsider down the road, and they blame other people because they were a wee youngin'. I think they need to be concerned about that. I just, I hope that the healthcare workers, healthcare professionals are taking this into consideration. I think it just poses to me, it only makes sense that it's going to pose a threat down the road. So there I said it. I hope I've been, I guess, I hope I haven't overdone it. My apologies to YouTube if so. It certainly wasn't meant to be that, but I think some people need to be concerned about the potential tragedies that could ensue. So with that, this is Treasure Troller saying aloha and good day.